Lee Pinkoson is the current chair of the Alachua County Commission and is in the middle of his 16th year, having been elected in 2002. Born and raised in Alachua County, Lee attended all local schools and graduated from the University of Florida with a degree in business administration. Recently retired, he enjoyed a 31-year career in opticianry, owning a business for 22 years. Lee has 3 sons and is married to Tina Pinkoson. He has promised her not to seek another term. Welcome, Lee.
Welcome, Mark.
Thank you. You know, I was going to read some of your affiliations and some of the service organizations you belong to, but I want to have some time for questions, so I'm going to skip that.
That was good.
So, Lee, let's start with just tell me why you ran for county commission 16 years ago, almost 16 years ago.
Well, the original motivation was I felt like everybody in the county deserves an opportunity to be successful. And I didn't think that that was necessarily the case, that if you had your slice of the pie, you would continue to do okay. But, you know, there are an awful lot of people in Alachua County. We have a 23% poverty rate. And I felt that we could, you know, hopefully offer people more as far as a way of life was concerned.
Well, and certainly economic development and jobs and the equality, economic equality has been a recurring theme in everything you've done on the commission.
Yep. What
has been your favorite aspect of the job?
I think just the individual contacts with the citizens. You know, there's, as we all know, government can sometimes be complicated, and sometimes people just need some help navigating the system. Mm-hmm. You know, you get a phone call, you know, such and such is happening, and can you help me out? And just, you know, there's been more than one occasion where I did not do a darn thing. I just listened. Mm-hmm. And when, as the people were hanging up, they said, well, thank you very much for all your help. And I said, okay, well, I'll take that. You know, and, but there are times when you can help, you know, make a difference as far as intervening in what's going on with maybe a particular department and help, you know, help come up with a better solution. And I think that's probably been the most fulfilling thing.
I know that taxes and millage rates have always been of great interest to you, and can you talk a little bit about what's happened with millage rates, particularly of late?
Well, the millage rate was higher when I got on the board, and during the course of the 16 years on the board, it's fluctuated. It's never gone higher than what it was originally, but you know, there were a couple times where it flirted with it, but. The legislature did something, I don't know how many years ago, 8 years ago or so, where it dramatically decreased the millage rate. And over the last few years, we've been trying to you know, conscientiously lower the millage rate some each year. And we've been relatively successful. And last year, we were actually able to go to the rollback rate, which is, you know, means something.
Yeah. You know, you mentioned your original reason for running, and you've certainly clearly demonstrated your support for social service programs like CAP and Choices and court services and all the things that help people. I know you're particularly excited about the children's services aspect of the job, so tell us what's going on there.
I'm very excited about it. You know, children don't ask to be born, and they deserve the opportunity to be in a position to be successful or compete. You've heard this story 100 times, but you know, my son taught at Lake Forest first grade, and you know, he would help. He asked, you know, did I want to do anything? So I'd go in there and I'd ruin the children's reading career, and I'd sit there and let me tell you, there's nothing neater than when it clicks and a child, you know, can start reading. I mean, but during that time of doing that, you recognize very quickly that there's some children that just don't stand a chance, and it's just not, you know, it's just. You know, it's just not deserved on their part. So children have always had a very special place in my heart, and you know, it had something to do with the Success by 6, mm-hmm. which is an initiative that tries to prepare children so that they have what they need nutritionally, emotionally, educationally, so that when they start school, they can actually start learning. Because if a child isn't prepared when they start school, then you know, they're swimming upstream, and most likely they're not going to catch up. And as a result, whether you're, you know, hard left or hard right, you know, it's the right thing to do from a, you know, just a good thing to do. But also, if the child isn't ready, then you're probably going to have to do something for that individual throughout their life.
So, aside from the obvious good deed, you could also argue that this is just fiscally responsible.
Yes, there's no question that you can make that case.
So the board, a couple years ago, you approved the the Children's Services Advisory Board,
Correct.
and put substantial funding behind it, and there are
$1.25
several.
million.
That's right. And I know they have some programs starting. One really exciting one is the home nurse visit program. Tell us about that.
Well, it's the opportunity where when a child is born, there will be a nurse that will go in and evaluate the child and the family. And that's what's so exciting about these programs, is it not only will help with the child, but it also will assess the child's home and the parents and see if there's anything that there might be a better way of handling things. So often, and this is part of the problem as far as poverty, and if you've never had a good role model, it's hard to be a good parent, you know, if you haven't had that role model in the past. So what this has the opportunity, and this is one of the ways of doing that, is the nurse will come in and make an assessment to see if maybe there's some other programs that might assist the family as they, you know, in the early stages of childhood. So it has a real chance of changing things on a generation basis.
Right. I know you had the pleasure of running into the two Dorothys during your tenure, and
they're great people.
the SWAG group
Right.
that is responsible for so many transformational things over in the Tower Road area and other areas. Tell us a little bit about SWAG.
Well, the interesting thing is it actually started, the sheriff's office had I think it was an after-school set up over there in a neighborhood apartment or condo, and that was a violation of the codes. So she had to shut it down, and as a result, the neighborhood and the sheriff said, you know, we need to do something. So there was a big meeting over, I think it was at the Tower Road Library, and the place was jam-packed. And but what was the neatest thing about it was, it wasn't just saying, the people weren't there saying we have a problem, fix it. They said the neighborhood has some ideas. Would the county commission think about partnering with us? And they did. We have, and it started out with the resource center, which is a place where children can go after school, and families can go, and there's affiliations. What is it? The Partnership for Strong Families is running it, and it's just the number of people that visit that facility is remarkable. And then the next part was the health clinic that was over there, and thank goodness our health department people, Paul Myers and company, felt that was a real good investment, because it's very hard from somebody to get from, I think it takes 2.5 hours to get from SWAG over to the health clinic if you have to go take the bus. So it's been a huge success, and they're about to, I think this summer, they're going to start opening with a child care facility. So what's neat is hopefully what we're doing is we're taking one of the areas that had the most significant issues, and we're transforming it, and you know, that will be something that will be kind of neat. I can look back and say, you know, maybe I had something to do with that.
Yeah. You know, I know you've also been a big supporter of the CAP process, the
Right.
Community Agency Partnership Program, and that's just one more spoke on the wheel of trying to help people kind of rise out of poverty. And tell us a little bit about CAP.
Well, CAP's interesting. There's you know, there's a few people out there that think that you know, why are we doing this? And one of the responsibilities of county government, which I didn't know when I first started this, is social services. So we have a responsibility to try to take care of some of the difficulties that people encounter in day-to-day life. And what the CAP program does is we contract with different entities, and they provide the service that they do on a daily basis, because otherwise it might entail the county doing it. And as much as we would like to think that we do everything well, you know, there are some times when it's better to contract out.
Right.
And the various entities do a great job at what they do, and you know, candidly, most of the money is very well spent.
I have heard you in the past gently correct people when they suggest that this is just giving taxpayer dollars to charity, and
Right.
explain that this is contracting for services that the county is responsible for providing.
Right, and you know, it's like Meridian.
Right.
You know, the county is not in the business of mental health, so we contract out, and thank goodness we've got partners like that.
Yeah. Choices, that was during your tenure,
Yep.
the Choices Healthcare. And it's interesting, if you could tell us a little bit about Choices originally, and then how the Choices fund balance, when the program ended, has continued.
Yeah, the Choices program that was championed by Commissioner Chestnut at the time, Cynthia Chestnut, and was passed on a referendum. And what it did basically was provide people funding for health care who kind of fell through the gaps as far as whether they were supplied health insurance at work.
Mm-hmm.
If they didn't get that, or it wasn't sufficient, it allowed the people that I believe economically challenged, income challenged, to get good health care. Mm-hmm. And that was a program that lasted for 7 years.
I believe it was seven years. Yeah.
And we had a fund balance at the end. And what we did was, with that fund balance, we made it so that we can make that money go a little bit further. And I believe we have a 10-year program. Part of it is divvied out in healthcare services for people that just have no health care whatsoever, and also for mental health.
Right.
And so in both those areas, we've managed to continue to provide service for the people that need it the most.
I know you've been very involved in the CJMSAG grant. So tell us a little bit about that.
I think we're on our fourth edition of it. And I think so. We've been doing it for, I think this is the fourth one. So I think we've been doing it for at least 12 years and continuing forward. And what that does, it allows us to address some of it, because unfortunately, a very large percentage of the people that are in our jails suffer from either substance abuse or mental health issues. And what this does is it allows the opportunity to hopefully allow some of these people maybe to not go to jail, or while they're in jail get some of the help that they need. So maybe you can cure the problem as opposed to treating the symptoms. And the county spends an awful lot on mental health. I think yesterday we determined that it was somewhere substance abuse and mental health, we spend somewhere in excess of $4 million. So it's something that does cost the county something, but it is very much an issue, a societal issue.
I know when we were talking, you were also particularly proud of our crisis center, which is one of the few government-funded crisis centers, suicide hotline things in the United States.
Yeah, at one point I think we were the only one. I think you said there were two now.
Yeah.
But what that does, it allows our citizens to call, and if they're in they've got some sort of crisis situation, we have a remarkable amount of volunteers. The number of hours is, if you were to see it, is staggering, and the cost that it saves as a result of those volunteers is absolutely amazing. I think it's over $1 million. But what it does, it provides a person who is in a crisis situation to talk to somebody, mm-hmm. And to for someone to listen and perhaps recommend what the next step is to solve the person's issues. It's truly a remarkable program that we have.
During Hurricane Irma, they coordinated and ran the 311 rumor control line that mm-hmm. took a great deal of pressure off of law enforcement and 911, and so really essential services.
Well, and also which hadn't been brought up, the victims advocates and what they do. These are people that when somebody has had something terrible happen to them, these people go out all times of the night to go help a person through what can only be described as a crappy situation. Right. One of the worst events that they'll probably experience in their life, and these people are kind enough to go help them through that situation, with law enforcement and do whatever needs to be done. And it's unfortunately we have to have thankfully we have it. Unfortunately we have to have it.
So you've been on the board since the county commission took on the enormous.
I've been on the board since we were using a chisel and rock.
That's right. But you were around when the enormous task of trying to end homelessness became a county commission priority.
Yep.
And you've been very vocal at articulating all the things that the county does to do that.
Right.
But also the county has joined with the city of Gainesville in terms of providing funding for Grace Marketplace. And tell us a little bit about that whole effort.
There's a discussion going on now currently. What's the best way of doing it? The Grace Marketplace provides a certain type of service, emergency shelter. And I think most of the experts, and we've had at least 2 come in and tell us that really if you want to solve the problem, which incidentally, not being critical or not being pessimistic, the problem will never ever be solved because there's a percentage of people that just don't want to be part of, you know, they want a different life. And but for those who do, because unfortunately a large percentage of the homelessness population suffers from mental issues and substance abuse issues. So that's really, you know, we can play a big role in that. And the fact that we're helping with the housing component just shows how wonderful we truly are. So.
You know, I always kind of see court services and community services as 2 sides of the same coin. One of the things that you've been very supportive of is our many different diversion programs. Teen court, mental health court, drug court, veterans court. And I think you've been particularly effective in making the case that it is, again, just from a fiscal responsibility point of view, it is cheaper to help people before they go to jail, before they get into the criminal justice system. So tell me about your support of those efforts.
Well, there's no question that if you can divert somebody from the jail, because if they go to jail, they're probably going to lose their job. You know, and it just kind of spirals from there. If they, you know, if their job supplies, you know, health insurance, they don't have health insurance, and you know, it creates issues with the family as well. So if you can treat the problem as opposed to the symptoms, you know, maybe you can that person will no longer be in the judicial system any longer, and that's really the goal. And granted, you know, from a practical standpoint, you know, a person has to be ready to do that. And I think that our court services people do a good job as far as identifying those individuals that will do well in the programs. And I think, I know that those programs have been very successful.
I'm going to move through some issues now because we've got 28 minutes to cover your 16 years in office. Okay. I know roads has been an issue that there aren't a lot of people that are passionate about roads, but you have a passion for roads. And tell us about your support for roads and some of the things you're most proud of and some of the challenges. So,
you know, there were times when we put some money during my 16 years towards roads, and we did roads like 24th, 53rd, 236, part of 236. Then we went through a lull, and lately we've been putting some money towards roads again. We did 231. We just did 16th Avenue, and now that I'm leaving, we're about to, you know, really put Public Works into play. We're going to do 43rd. We're going to do Tower Road. You know, there are a number of roads that we're going to do, and hopefully the commission will continue to put money towards roads, because that would mean each year we can get a few roads done.
You know, you mentioned basic core services and you mentioned fire rescue in the same breadth as roads, and you know, there's been a huge commitment to fire rescue during your tenure here. I think 3 fire stations and 1 rescue station has been built. Tell me about how you feel about that.
Well, you know, again, that's one of our responsibilities, and obviously those make a difference.
Right.
While, you know, what's interesting is you really don't have that many fires now. But fire, probably their biggest responsibility now is to get people medical attention as quickly as possible, because there are more of them than there are of ambulance. So, a rescue unit. So they are a key component of the overall emergency situation. And you know, the number of calls that we've gotten have escalated so much that over the past few years, I think we put 4 or 5 new units on during the peak times, so to help with that situation. It has lowered the overall number as far as per unit responding to calls, which means that, you know, quicker service.
During the last 16 years, we've added a number of facilities to the county, and I mean, the list is long. The fire rescue stations, the senior center, the Freedom Center out at Freedom Veterans Park, the Public Defender's Building, the jail expansion, the Property Appraiser, Supervisor of Elections Building, and I know you're proud of all of those facilities. I know you're also proud of just the overall philosophy of efficiency in our buildings as well.
Well, what we've tried to do is if we can, while we're doing whatever we're doing, if we can make the buildings as energy efficient as we can, obviously that makes sense, especially with what energy costs are. So obviously that makes a difference, and we tried to situate so to make it so that, and we're about to make a change to make the development process as convenient as possible. If somebody needs to go get a permit, they can do it all in pretty much in one location, and that makes sense, because currently somebody has to go one department, then another department, and they frequently have to go to multiple buildings to do it. So we've done well in what we did with the property appraiser and the supervisor election. We got them in a building to fit their needs, and what's good from the standpoint of the supervisor election, and I guess the property appraiser, is that there's parking there, so parking is not a challenge.
You mentioned that we had 3 road taxes that did not pass, but
yes,
during your tenure, revenues have been available from 3 referendums that did pass:
right.
Alachua County Forever, Wild Spaces, Public Places in 2008, and then again recently. So you have seen a dramatic increase in conservation lands and parks.
Yes.
And I know one that you're particularly proud of is Rotary Park out in Jonesville, and that began and got to where it is now during your tenure.
That one's kind of special because originally it was just called Jonesville Park, and we were approached by the Soccer Alliance initially. And what's really neat is most of that was funded through public-private partnerships. It wasn't through Wild Spaces or Alachua Forever. It was, the Soccer Alliance put in, I believe, $500,000 worth of things that need to be done out there. Then the tennis facility, somebody approached us about doing the tennis facility out there, put a lot of money in towards it, and we have a premier tennis facility there. And then Rotary was interested in doing something locally, and which is kind of neat because I'm in Rotary, and so I got to help as far as that and getting the two together. And Rotary put a substantial commitment. We've got some baseball, softball fields out there. So and after that, it was named the Rotary Park. So that one's special because I had something to do with it. So that's kind of special. And as far as the Alachua Forever and Wild Spaces Public Place, I mean, I've been on the board ever since we bought the first piece of property, and it definitely will make a difference in the long run, and because you do want to conserve some of the property, so that ultimately people will see what is way after I'm gone and you're gone and everybody generations, that there'll still be something, and you want to protect it as far as from the water quality as well.
I know that you've done several tours of duty at the library governing board.
Yeah, I think I've been on there 14 to 16 years.
Is that right?
15 or 16 years, yeah, I've been on there.
Tell me about your service there.
I tell you, that is a remarkable entity, in that, and granted they only have to focus on one thing. They do a remarkable job. We've lowered the millage rate there. You can assess up to 1.5 mills, and we're down to 1.3 or about 1.3 that they've got enough money in there to build the facilities that they need to build as they come up, and they just the way libraries what they used to do and what they will do in the future is evolving, and they're doing a great job of not becoming obsolete.
Yeah.
They do a good job.
I'm going to end with just a conversation about the Florida Association of Counties. I don't think the average citizen has any idea your work on that, and the way you have championed home rule and local governments, particularly in their relationship with the state government.
Right.
And you've served on multiple boards and have been instrumental statewide in protecting home rule. So tell us about your service there.
The counties are a subset of the state, and So what the state does definitely has an impact on what the counties do. And through the Florida Association of Counties, they offered some courses initially about, here's what your responsibilities are, and that was staggering. And what's great for a number of reasons, it's a resource, but also you get to meet other commissioners and from larger and smaller, and you can see how they deal with certain issues, if something comes up. So you don't necessarily have to reinvent the wheel, or if they can tell you, okay, we did this and it didn't work so well, don't do that, and so it's a very valuable asset for commissioners if they choose to take part in the association, because what the association, they do a great job, not to sound negative, but they do a great job of fending off bad legislation that will adversely affect the counties. And they do a great job in promoting what the counties do, so that hopefully the legislatures, if they're willing to listen, here's what they do. They are an asset. We are not the enemy, because every county is different, and when legislation goes through, it's one size fits all, and sometimes they don't necessarily know what's happening in the individual counties. So it makes a difference, and it's certainly been a privilege to do whatever I've done with the Florida Association of Counties.
Yeah. Well, speaking of privilege, it has been my privilege to work with you my entire time here. You've been a commissioner, and I know in speaking to county employees that there is a huge appreciation for your involvement with county employees. Every event, every time there's a way to interact with employees, you've been there, and there is a great deal of affection for you among staff.
Well, I want to tell you that the people in Alachua County are very lucky to have the individuals working for the county, for the people, because it's just remarkable to see that the people that work for the county really do care about what they do and the people that they help and serve. It's with everything. When you have as many people, there may be a bad apple, but I would say by far and away, the people that work here are really, really good people, and it's truly been an honor. What's neat, Mark, is I consider you my friend. And I'm lucky to have that. And hopefully, when I'm off the board, when we go, I see you in public, you don't spit on me or anything. But it's been an honor to be in this position. Hopefully I did some good while I was on the commission, and it's just it definitely will go down as probably one of the highlights of my life is being in this position and trying to make a difference in Alachua County. And hopefully, and what it kind of boils down, hopefully my family thinks I did a good job. That's important as well.
I know that's important to you, and thank you for being here, and thank you for your service.
Yeah, sure thing. All right.